If you or someone you love is diagnosed with a life-limiting terminal illness, you don't just need help, you need compassion.
That's right, and joining us now for National Hospice Palliative Care Month, our nurses Julie Mcintosh and Jennifer Lowery. They're here with Compassion Care Hospice. It's great having both of you. Jennifer's also the clinical director, worth noting. Welcome in.
Welcome.
Thank you for having us.
Thank
Good
you.
morning.
Happy to be here.
Tell us about hospice care and how this differs from traditional health care.
So I think if we think about healthcare on a continuum, on one side we have traditional healthcare, which tends to be curative in nature, aggressive, right? If we have an illness, we go to the doctor, we want it cured. Even our chronic illnesses, we hope we can at least manage them. But at some point, when those diseases no longer can be cured or managed, we come to the other side of the continuum, which is palliative care. We know we can no longer cure the illness, but what can we do to keep the patient comfortable?
To manage it, yeah.
Manage any symptoms they're having, whether it's pain, respiratory distress, anxiety, nausea, and really focus on quality of life for whatever time the person has left, and really be very holistic and provide emotional and spiritual support to the patient and their family during the end-of-life process as well.
It really is a whole very loving, I think we said in the intro, you know, like a nurturing experience that you're offering. And it's a wonderful alternative. Sometimes people don't realize they're going to face that time with a loved one. All of a sudden, it's upon them. Right. So it's actually like an important conversation to have right now, just to plant that seed that you are there and you are available.
Yes, and we really encourage patients and their families, physicians, nurses, to seek help with hospice well before the very last days of hospice. That's something that we really struggle with as hospice care providers. If we can get in and get patients comfortable, address their social needs, emotional needs, and physical needs earlier on in the disease process.
Their quality of life should
It is, and actually people tend to feel better. They can enjoy each day that they have with us.
No question.
Yeah.
There are misconceptions, I'm assuming, that when people hear the word hospice, what are some of the misconceptions you hear?
I don't know if you have it on the screen. We actually sent over 10 things to know about hospice, which
Here
is
we
available to anybody if they'd like to have a copy of that. That's a really good tool. I think probably the biggest misconception we hear is that hospice is a place that you go to die. So we want people to know that hospice care actually is a concept of care, again, focused on palliative care. We come into the home, wherever the patient lives, private residence, they could live in an assisted living or a group home setting, even a skilled nursing facility, what we used to call nursing home. We come in and we provide care to the patient in their home, and I think that misconception comes because we do have what's called inpatient hospice care, but it's meant for very short-term acute crisis management. Something's going on, they can't be managed at home, their pain is out of control. We might bring them inpatient for a short period of time until they're stable, and then the goal is always to get them home again. 98% of all hospice care is provided at home. So that's probably the biggest misconception. And then Jen, do you want to take the next one?
I think another misconception is that you have to wait until the very last minute, that hospice is a place that, well, not a place, but also hospice has to come in when you have days or weeks left. And like we discussed a little bit earlier, it really isn't. It's a care that, it's a benefit and care that we earn over our lifetime. It's afforded to everybody. It's actually more about living, and at Compassion Care, that's our focus.
No question.
We want to focus on living your best life, and intervening as early as possible in that disease process.
It also can be, I would imagine, a very comforting experience for the caretakers and family. I know I helped my father through his leukemia, and he was in the hospital. And just the rigmarole of us family coordinating who would be there when and taking care of the house at home at the same time was challenging.
And we do provide care for not only the patient, but their family and loved ones and caregivers as well. So it's a holistic approach in that sense that we like to make sure we address the needs of everybody involved.
Really quickly, we're running out of time. I think people are hearing this all sounds fine and well. It sounds really expensive, though. Not the case.
Not the case at all. Hospice care is provided for free. So if somebody qualifies, if they have a terminal illness that has reached that stage, they no longer want aggressive treatment, hospice is provided 100% free under Medicare A, 100% under Medicaid. The VA has a hospice benefit, and almost every private insurance company as well.
That's great.
It's amazing.
You're providing a great service, and it's great having both of you.
Thank you both so much.
Thank you for what you do.
Compassion Care Hospice. They're there when you need them most. You can visit their website or call the number on your screen to learn more. Compassion Care Hospice, a proud sponsor of the Morning Blend.